My name is Alex Cope, and I'm a consultant general and colorectal surgeon working at Frimley Health NHS Trust. So general surgery is very broad, and that breadth gives you a lot of variety. I think growing up, I was always interested in science, and good at science at school. But the thing is that my real love is people. I couldn't bear the thought of being in a lab doing research, experimental work all the time. I wanted to be out and about with people. The beauty of general surgery is it's a craft specialty. It's working with your hands, but at the same time, it's lots of consultations, meeting with people, talking with them about their expectations, their problems, and thinking about how best to help them in that individualized fashion. So I suppose what I do is actually colorectal surgery within general surgery. It's a subspecialist area of mine. I think what I find most rewarding is really that the kind of symptoms that patients come to me with are often a little embarrassing or socially embarrassing or awkward. It's regarding problems with their bottom or how their bowels are working. And I find what's actually rewarding is putting patients at ease, making them comfortable, being able for them to tell me exactly what symptoms are troubling them, opening up about their concerns, and then being able to investigate and help them appropriately. Colorectal surgery is a mix between cancer work, malignant work, and benign work. And so some of the surgery that I do is very major, and I use lots of adjuncts such as the Da Vinci robot to help with the technical aspects of that job. But other operations that I do are minor day case surgeries for things that are equally troubling a patient in terms of the symptomatology and their concern and worry about their problem with their bowel or their anus. And what's really rewarding is actually being able to help and being able to reassure people and being able to sort out those difficult problems that people don't really want to talk about. When patients come to see me, the first thing is that I want them to know that this is a very private, tailored consultation. So I will listen to exactly what their concerns are. I will take a full history and I will want to do a full examination. I want to know everything about them. So I will often ask patients, what do you do to keep yourself busy? So they get an idea of their level of activity at home, about their interests and hobbies, because actually those things make a huge difference to the tailoring of my various treatments. If you're thinking about continence and bowel problems, if a patient's going to be out on a golf course for 18 holes and hasn't got access to a toilet, it's rather important to know that at the outset. So when patients come to see me, they will have take a full history and examine them, but also understand a little bit more about the patient, about what their hobbies and interests are, as well as the medical problem they've come to see me with, so that I can provide a really tailored treatment for that patient.